Hey, I'm Tamara Kendacker, and you're listening to The Decibel from the Globe and Mail. Schizophrenia is one of the most devastating mental illnesses you can live with. During psychotic episodes, symptoms can include hallucinations and delusions. It impairs your sense of reality, your ability to make decisions and relate to other people, and people who are diagnosed with it die 15 years younger on average, and they're more likely to be homeless, unemployed, or to end up in jail. And for decades, researchers have been trying to understand the underlying causes of schizophrenia, whether it's trauma or genetics or environmental factors, or all of that. And as you can imagine, the answer is pretty complicated. But one thing that many researchers now believe puts people at higher risk of schizophrenia is racism.
In a way, it's kind of like smoking and lung cancer. Not all smokers get lung cancer, but smoking increases your risk of cancer. And in some of the research on race and psychosis, the association between the two is even higher than the link between smoking and lung cancer.
Erin Anderssen is a feature writer for The Globe. She covers mental health, and she just finished writing a story about this research. She's going to take us through how people have thought about schizophrenia throughout history and why some researchers are considering the question we're talking about today on The Decibel. Can racism cause schizophrenia? Let's get into it. Hi, Erin.
Hi.
Thank you so much for doing this, and welcome to The Decibel.
Thanks for having me.
So I read your story this morning, and I got to say, it made me really emotional. And we'll talk about why at the end, but what made you want to start looking into this topic?
Well, of course, I cover mental health for the paper, and I'd been reading a couple of really interesting Ontario studies that were showing some equity issues around access to care. One of them had found that Caribbean African men are more likely to be involuntarily admitted to hospital for psychosis than the general population, often following a police encounter. There was another study that found that Black youth in Ontario were also waiting much longer for treatment following a first episode of psychosis. And in schizophrenia, waiting too long for treatment really reduces the chances of a positive outcome. So access to care is a really important public health policy issue. And then as you dig deeper in the research, this even bigger story emerged. And it was a finding that, despite covering mental health for 15 years, I was not aware of. And it was the finding showing higher rates of psychosis and a higher risk of being diagnosed with schizophrenia among people from Africa and the Caribbean who settle in majority white countries.
So this has been the subject of many, many studies over the years. And what does the research say?
I think what's astounding is it's research going back decades. There are, more than 100 peer-reviewed papers on it. It's a pattern that's been found in a number of countries. In the United Kingdom and the Netherlands, where it's been, I'd say, most extensively studied, what it's found is 5-time higher rates in migrants from the Caribbean and Africa being diagnosed with schizophrenia than the native-born white population. There's a study out of Israel that found significantly higher rates of psychosis in migrants from Ethiopia. In the United States, African Americans are also more likely to be diagnosed with schizophrenia than white Americans. In Canada, there's been less research. We're still pretty far behind, as we learned during the pandemic, on race-based research to start with. So there haven't been as many studies, but even those have found elevated risk among first-generation migrants from the Caribbean, higher rates of psychotic disorders in refugees from East Africa, and to a lesser extent from South Asia, compared to the general population. Why this is happening is still a big question. But as researchers went through and explored a lot of the options, the conclusion that many of them are circling around is that what might be causing these higher rates is the experience of racism.
So when did the link between racism and schizophrenia first come up?
Well, it's actually been a conversation even going back to the 1960s. An American psychiatrist named Jonathan Metzl wrote this great book called The Protest Psychosis, looking at what happened during the civil rights movement with respect to schizophrenia, and how even the language, the definition of schizophrenia became much more focused on aggression and hostility. There were a couple of American psychiatrists who wrote this paper where they actually referred to the protest psychosis and suggested that especially Black men who were being influenced by the civil rights movement to have hallucinations. They talked about delusional anti-whiteness. I mean, when you read it, it's just really astonishing. They were running ads in medical journals for medication like Haldol, which was used to treat psychosis, featuring the face of an angry Black man, like raising his fist. One paper was called 6 Years of Sit-ins and suggested that being involved in civil rights actions led to hallucinations and psychosis. So, I mean, Jonathan Metzl really makes this point that drifting through psychiatry was this kind of, it just kind of filtered in. It became like a structural framework for psychiatrists that aggression and hostility was related to schizophrenia. I mean, there were a lot of psychiatrists who argued against that. That wasn't even a majority, but because the language shifted in the DSM, which is basically like the Bible for psychiatry, it kind of became a disease that Black men were more likely to get diagnosed for.
Right. So there was this idea that fighting for social change and protesting against racism could cause schizophrenia. But there were people who were skeptical of this. And there was this psychiatrist named Frantz Fanon. And tell me what he thought about all this and what he argued.
So in the 1960s, Frantz Fanon wrote a book called The Wretched of the Earth, in which he proposed that racism itself caused mental illness, including psychosis. Basically, he was arguing that what he was seeing in his patients was the mental health effect of the stress of colonialism. He had also written in the 1950s this really fantastic book in which he explored his own experience with racism and just having to constantly make adjustments for white society, even being, a very educated Black man, and just how it eroded his sense of self. It kind of sliced away pieces of his reality. So I think that the book that he then wrote in the 1960s was really an extension of not only his own experience, but also what he was seeing in patients, the anger he was seeing in patients, the frustration, and just the mental health toll that the stress of racism and colonialism was taking on them, and how that was, manifesting as severe mental illness, including psychosis.
So this idea emerged a long time ago, but it took a long time for modern science to catch up, right? Like, what are some of the theories that researchers explored to explain why racialized people are diagnosed with schizophrenia at higher rates?
I mean, I think that was actually really fascinating to me, because in the research, you can see how researchers kind of went through almost a process of elimination. One of the researchers I interviewed is Kwame McKenzie, who's the director of health equity at Toronto Centre for Addiction and Mental Health. And some of the work that Kwame McKenzie has done really kind of takes you through, is it this, is it that? The first theory was that migrants were bringing schizophrenia with them to their host country, so that maybe their country of origin had higher rates. Researchers have gone back to countries and not found higher rates of schizophrenia. And if you think about it, it doesn't actually really make sense, because to leave your home and go and settle in a foreign country requires, a level of skill and initiative that would be really hard for someone who, had schizophrenia to do. So actually researchers say migrants who are also medically screened often by the host country before they can come should actually have lower risks of schizophrenia. So another theory was that the trauma of migrating itself was a risk factor. But when researchers started slicing and dicing the data and looking at different groups of migrants, you can see that where you come from and where you end up matters a lot. So if you're moving within a European country to another European country, your risk, it may be slightly higher, but in some cases even lower. If you're coming from Africa or the Caribbean and you're moving to a white majority country, your risk is higher. So it kind of challenged the notion that just migrating itself was a factor.
And the other thing that wouldn't be explained by the trauma of migrating, putting people at higher risk of having schizophrenia, is that, like, it doesn't explain why the risk is still higher among the children of people who migrated.
Yes. I mean, and in fact, that's what happened to a number of theories. They might have applied to the first generation of migrants, but they couldn't explain why rates remained higher in the children of those migrants. For instance, I mean, the one theory was that it could have been a complicated birth, which is known for being creating a higher risk of schizophrenia. But that didn't explain the first generation of migrants. And in any event, as Kwame Mackenzie points out, when they looked at it, they did not find that there were more problematic births in the African Caribbean population in Britain compared to the native population. Another theory around schizophrenia is that it may be caused by a lack of vitamin D in childhood. But again, that might explain the second generation who had arrived in the host country, but it didn't explain the first generation.
There is a theory that cannabis puts people at higher risk. And is that something that they were able to eliminate, or how did they account for that?
The association between cannabis and schizophrenia, for starters, is very complicated. The idea that cannabis alone can cause schizophrenia is not, I would say that's a controversial idea. But when I asked Kwame Mackenzie about that is an issue they looked at, and they found that cannabis use among African Caribbean migrants in Britain was actually lower than the British population. And even so, the risk, the association between cannabis and schizophrenia is lower than the risk of migrating and schizophrenia.
Mm-hmm. The last risk factor I wanted to ask you about is living in a city, because there are researchers who believe that the chaos and isolation of living in a city could be contributors.
The research linking living in a city to an elevated risk of developing psychosis is pretty strong research at this point. But I would say that researchers don't really know what's going on. But the exploration of what was happening in a city did lead researchers to an interesting finding related to migrant populations. And what they found was that when you live in an area with high ethnic density, so there's a larger concentration of people from the same ethnic group, the rates of schizophrenia were lower. So it's not clear, again, why this is. The obvious conclusion is that having more people like you is a protective factor. It leads to more social support, a stronger sense of belonging. The research is still unpacking that. But that finding was so powerful that I think it led a lot of researchers to begin exploring this notion that being treated as an outsider, experiencing racism, could be behind these elevated rates. A risk factor isn't a direct line to schizophrenia. I mean, most people who experience racism don't develop schizophrenia. Most people who live in cities don't get it. Most people who have a parent with schizophrenia don't develop schizophrenia. But if in your life you have an accumulation of risk factors, maybe there's a hidden genetic link in your family, you experience trauma as a childhood, you go into an environment where you are constantly feeling othered by the majority population or treated less than, as Frantz Fanon talks about, then that accumulation is what researchers suggest puts you at a higher risk. So in a way, it's kind of like smoking. It's kind of like smoking and lung cancer. Not all smokers get lung cancer, but smoking increases your risk of cancer. And in some of the research on race and psychosis, the association between the two is even higher than the link between smoking and lung cancer. So It's pretty strong, but unpackaging everything that's going on is more complicated than just point A to point B.
Given the racist associations between like Black people and schizophrenia that we just talked about historically, is it possible that doctors are getting the diagnosis wrong? Is that a possibility?
Schizophrenia isn't diagnosed with a blood test or even a brain scan. So because hallucinations and delusions also happen in mood disorders such as severe depression or bipolar disorder, and in the US, studies have shown that Black patients are less likely to be diagnosed with a mood disorder, even if their symptoms are the same as a white patient. And let's even say that a big part of the story is doctors making mistakes for all kinds of reasons. I interviewed this researcher, James Kirkbride, who's a British psychiatrist who's been studying this problem for I'd say like 15 years. And he points out that even then there would still be a race problem because a group of people are being overdiagnosed and labeled with a devastating, debilitating mental illness. But I also spoke to a researcher named Deidre Anglin in New York City, who's also been looking at the elevated rates. And she would say that while clinician bias probably has a role, her research would show that chronic stress and the experience of racism are probably more significant factors. For one thing, the rates are so much higher that she says it's unlikely that clinician bias could account for all of them.
The thing is, not everyone who experiences racism ends up having schizophrenia. And we talked about all these other risk factors, but I'm wondering, is there a kind of racism that is more harmful?
Deidre Anglin, who is a New York psychologist, is doing this really interesting work looking at kind of like the precursors to a diagnosis of schizophrenia, the symptoms that suggest you might be at higher risk. And what she has found in her work is that the more experiences you have with racism, the higher those threshold symptoms are, such as altered perceptions, paranoia, or suspicion. The kind of way you might start thinking if the society that you live in that is supposed to treat you equally, that where you're supposed to have equal opportunity, is kind of working against you, but in visible ways that you can't always see. But again, I think it's important not to oversimplify, and researchers also made this point. And so some of these questions still have to be answered. But Kwame McKenzie made this great point to me. If you go to war, we now understand that you can have a mental health issue from the trauma of that experience. The high pressure of Bay Street can lead some people to develop anxiety and substance abuse. So as he asks, just about every other type of trauma can lead to mental illness, but racism can't.
So how does the research explain the link between racism and schizophrenia? Like, how would racism cause schizophrenia in the brain?
One theory about what causes schizophrenia is the social defeat hypothesis, that the long-term experience of being excluded from the majority group eventually leads to chemical changes in the brain. One American health researcher has coined the term weathering to describe the way that racism wears down a person and even leads to physical health problems. I interviewed Myrna Lashley, who's a social work professor at McGill, and she talked about the way that racism can make you question the motivations and the behavior of people. She described the energy that you have to put into figuring out what's real and what's not real, and the questions that you're kind of forced to ask. Was I seated in the back of the restaurant because that was the only table? Or is it because I'm Black? Are the police following me or just going in that direction? And she talks about that hypervigilance to potential threats, the stress that you have to hold in all the time. And one of the current theories around what could cause schizophrenia is chronic stress. Chronic stress weakens the immune system, and that's been linked to increasing the risk of psychosis. And what is racism but a severe form of chronic stress?
Right. And then like when people deny that your experiences are real, I imagine that adds to the stress. I mean, that adds to the stress even more.
Yes, absolutely. Dr. Lashley really spoke about that as well. If you come in dealing with a mental health issue and you talk about your experiences with racism and they are cast aside as being irrelevant to the symptoms that you're experiencing or the health issue that you're dealing with, it's not a full way to treat a patient, to see them as a full person.
So racialized people are more likely, if they're diagnosed with schizophrenia, to spend more time in prison than white patients. And I was wondering, actually, if you could tell me about Sean Pendente.
So Sean Pendente was a Toronto youth court worker who was charged in 2010 with sending death threats to a number of judges and court officials. And Sean has a really interesting story. He was born in Canada. His parents had migrated separately from Dominica and met in Toronto. And he had a very traumatic childhood. He suffered abuse. By 16, he was living on the street. When I interviewed Sean, he described the letter that he sent as being filled with wrath and angry. He talked about the court officials being judged and going to hell for their part in what he was perceiving as an unjust system, particularly toward the young Black teenagers that he was shepherding through the court system. He was charged with uttering threats and sent to jail for 4 months. And in jail, he was diagnosed with schizophrenia. He spoke with a lot of insight about his illness, and he just talked about how he felt that what he was seeing in court had kind of triggered his own childhood trauma, his own experience of living on the street. He spoke about the weird space of being responsible as a court worker, but also feeling judged as inferior, and how this was an exhausting parallel reality to live in. And Sean's case is interesting because obviously race is a factor. I mean, I guess one of the questions that I had was he's a court worker in the system. He sends a very bizarre letter, and instead of thinking that this might be a mental illness, he ends up going to jail.
There's a lot to think about here, and it's hard. It's a lot to process. And I think I said at the beginning that I felt emotional reading your story, and it was just the idea that racism can be such a stressful experience and cause chronic stress to the point where if you have a lot of underlying factors, the research suggests that it can put you at higher risk of getting schizophrenia. So I guess my question is, what are we supposed to make of this? And what was your takeaway when you were done doing all of this reporting?
For me, it was really a stunning finding because schizophrenia is such a devastating illness. It forever changes the lives of young people. It creates immense pressure on families. It is disproportionately expensive for the healthcare system. Whatever is going on with that statistic, if you're being misdiagnosed with schizophrenia, is terribly stigmatizing. You're probably not being treated properly for the mental illness that you do have. If what is creating that risk factor and that association to schizophrenia is the society that you're living in, I mean, I think that's an urgent call for us to really address systematic issues. You know, I've been covering mental health for 15 years. And in the beginning, you know, I was writing about stigma, and mental health was hidden in homes, like this, you know, shameful secret. And now we're at the point where we've kind of tried to remove a lot of that stigma so that people can go for treatment. And we're unpackaging the genetics and biology of mental illness. But I think that, you know, certainly this has been one of the lessons of the pandemic, that, you know, health issues are not experienced equally, and we need to address inequities in the system to solve a lot of our problems, including our health problems. And so what you come away from this research is really seeing how an unhealthy community can do such harm to individuals. And On the flip side, if we are more open, if we address inequity, if we think about social justice in a more significant way, we can really change outcomes for people. So, I mean, in a way, schizophrenia is kind of like that. You know, it's a very dramatic example of the harm that we can do to each other.
Erin, thank you so much for this conversation. This was really, really fascinating. I appreciate it.
Thanks for having me.
That's it for today. I'm Tamara Kendacker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thank you so much to Erin Anderssen. You can find her on Twitter at Erin Anderssen. As always, if you want to email us, we're at thedecibel@globeandmail.com. If you want to reach me, I'm on Twitter at Anima_TK. If you haven't followed us wherever you're listening, do that so you don't miss any episodes. And if you haven't already, leave us a review on Apple Podcasts. Thank you so much for listening, and I'll talk to you tomorrow.